then the questions will be addressed at the end. We have a round table discussion. Good morning, ladies and gentlemen. We would want to welcome you to this webinar on laboratory logistics, which is being held by the African Consortium of Laboratory System Strengthening, which is made up of the University of Zimbabwe, Department of Laboratory Diagnostic and Investigative Sciences, Cape Peninsula University of Technology, Department of Biomedical Sciences, Stellenbosch University Division of Chemical Pathology, and University of Pretoria Department of Chemical Pathology, working in collaboration with the Africa Federation of Clinical Chemistry and Laboratory Medicine and Empower School of Health in Switzerland. We would like to welcome you all, and to kickstart us all, we would allow from the African Federation of Clinical Chemistry and Laboratory Medicine, Gizachaw Tadeo Akulu, who is a lecturer in the Department of Microbiology, Immunology, and Parasitology at St. Paul's Hospital, Millennium Medical College. He is a PhD fellow in the Department of Microbiology, Cellular and Molecular Biology at the Faculty of Life Sciences at Addis Ababa University, and is an executive board member of the African Federation of Clinical Chemistry and Laboratory Medicine, to just give a few remarks in the introduction. Over to you, Gizachaw. You can unmute, Gizachaw, and give your introductory remarks.
Yeah, thank you, Ian. Are you hearing me?
Yes, you can go ahead, Gizachaw.
Yes. Thank you for just your time and effort that you have invested with lots of partners to reach the African societies in an important subject that is going on, laboratory logistics. On behalf of the African Federation of Clinical Chemistry and Laboratory Medicine, I'm also happy to speak on this event, and my gratitude goes to Professor Rajiv Erasmus for his leadership and coordination among the member state countries. As you know, the African Federation of Clinical Chemistry and Laboratory Medicine is a continental federation and a member of the International Federation of Clinical Chemistry and Laboratory Medicine, commonly known that is IFCC and LM. So the FCC is just working closely with IFCC, and most of the activities are just emanating from the IFCC natural or activities on education, research, and just through collaborative activities along the member state countries. And the scope of the FCC is just working with its member state countries in Africa, and we do have more than, I think, 13 at the beginning of the membership, 13 African countries, including Egypt, Kenyan, Nigerian, and the Ethiopian Medical Laboratory Association, and the South African, Zambian, and Zimbabwe too. So when we take the members, if we take the Ethiopian Medical Laboratory Association alone, we do have more than 4,600 members of medical laboratory scientists in Ethiopia. And the level of the education is from BSc to that of the PhD level. And yeah, FCC is just closely working with the African universities like the University of Zimbabwe and yeah, the Stellenbosch University, the Addis Ababa University. Usually, most of the events are just conducted with the National Society's annual conferences. And our focus is on point of care testing and quality laboratory management system training. So we are just starting very recently, yeah, as the problem of the COVID and over lockdown poses on a face-to-face meeting and training. Yeah, we are just very recently trying to reach through webinar, and we do have webinars in the FCC platform, and once every month or two, we do have at least two webinars in the IFCC platform, and we do have also a scheduled meeting on the IFCC town hall meetings. So the aim of this, the FCC is just to endeavor on the improvement of laboratory practice, service, and research across the most of the African member state countries. Having said this, I'm really just happy to network with you and work with you. And after just the post-COVID lockdown will be solved very soon, and I'm happy really to network on face-to-face conferences and trainings in the future. And thank you, and I over to you.
Thank you very much, Giza Chao, for those kind remarks. And the African Consortium of Laboratory System Strengthening is there to address the challenges that we are facing in the African continent in the labs. And we know that these challenges are similar, and we can learn from one another and with our partners in order to improve the lab systems in Africa. And as you know, lab diagnosis constitutes a major part of your treatment. And in this laboratory logistics webinar, how we conduct ourselves is that we'll have two presentations. Then we have the questions at the end in the round table discussion. Our presenters, there are two. There is Chakando and Prof. Andy Bakalo. And in the roundtable discussion, we'll be joined by Prof. Rajiv Erasmus, and we'll be able to address some of the questions and the discussion that emanates from the presentations. So to kickstart us off is Chakando, who is the quality coordinator at Swane Academic Division, NHLS Base Camp, Swane Academic Division, University of Pretoria, Pinch-Off Campus in the province of Gauteng, who is going to present on the processes approach in an academic national reference laboratory that can minimize or eliminate stock-out for consumables and reagents. Over to you, Chaka.
Thanks very much, Ian. Thanks, colleagues, ladies and gentlemen, the co-panelists who are from different corners of the countries. I really appreciate the time and feel so humbled to be part of this proceeding. As it has been introduced, my task seems easy, but I realize that it's a quite challenging one. Hence, I'm working with this academic laboratory, which is quite huge. As I have highlighted, I will just try to get also some overview of the national reference labs, which we are talking about in our setting. As much as I understand that from all of us, the main purpose is just also to learn from one another. However, I have to make it so clear that our setting might be different. So how? So the purpose of my presentation is just to make sure that what we will be looking at today, for the leadership who are working or operating on different settings of the laboratories, be it in the university, because our setting is the university which is attached to the national, which is also aligned to the national health system. Is sort of a semi-parastatal, our settings, which might be different from other universities. However, it's a public service center for those who doesn't know how the NHLS is run. But here I wanted to make sure that everyone could understand how the reference laboratory, which we are talking about, the setting and the way things are procured in our setting, as well as how could you make a plan for your procurement so that logistically you could see how the management of such tasks could entail, and the way you implement your management tool for monitoring how things are supposed to be done when it comes to this logistical task. And also to look at when do we really have to do ordering in terms of our setting in this academic, and how do we evaluate our suppliers as well, and what documentation do we need to have in place as such. There are a couple of lessons which one could look at, and maybe one thing or two fellow colleagues who are listening could learn from that. So basically in this setting, as you know, we understand that whatever which we have to do, quality-wise, we have to make sure that we understand what we are doing. And we can describe that in a profound way to say, whatever we do, exactly we know what is supposed to be happening, because we know some of our institutions are attached to or inclined to political setting. However, as scientists and lab or personnel, we have to stick to what we are good at, which is quality management system, and to make sure that whatever which we have planned is well executed, because those activities which we have in our place or in our disposal, one day or with the funders or sponsors we have to be audited. So for that to be audited, do we understand what we are audited on? Hence, in order for an audit to happen, you have to first understand what you are doing. So I'll try to look at the setting which we have here in the context of the quality management system. So within the quality management system which we have, there are focal points which we adhere to at all times, of which we also urge people to look at that. You have to have them in place. For this topic, which I have said, we looked at it, whatever which we do, it has to be customer focused. Leadership or management has to take charge and outline what they need to do. People whom we are working with have to be involved, because if it might be a one-man show, at times it will never, in fact, it will never work. Because once you are not there, things just perish with you, or they go with you. So which is not supposed to be like that. The other important part which we look at in our setting was that everything we do, it has to be process approach, meaning that whatever we do, it is easier for us to know which step to be taken whenever there are gaps, or we have on whenever we want to troubleshoot. That process approach is quite important. The other thing which we looked at on these principles were that we have to have a very better or proper system approach management style. Above all, where things work for us, we have to make sure that there is a continual improvement on whatever we do. The other thing, as I said on my intro, that some of us, we are working on a setting whereby decision could be emotional because of maybe the affiliation or pressure or whatsoever, but we have to be factual on our decision-making points. Because if we work on the ground of saying things, we couldn't have any choice, whatever which we have to do, it was a matter of whatever which was taken then of the moment. That is not what the quality management principle which we thought we have to look at or to adhere to our setting here could entail. The other thing, it has to, because we are dealing with logistic here, you have to have a mutual beneficial supply relationship with whoever you are dealing with. We don't need favors in our setting. And those whom we are, as much as we are procuring or we are working in a professional setting, it has to be understood that what we are doing, all of us, we have to benefit, and it has to be done accordingly. So these principles are what we look at when we put our setting in our academic setting. The academic which I'm talking about here, which is specific in Tshwane, is a very big hospital with about, we operate with about 64 clinics who are working with our laboratories, and one other extra district hospital, which is a little bit lesser, I mean, smaller than the academic one, but all of those things, I mean, those setting or institution are being serviced by this academic national reference. On top of that, we have regional laboratories which also send work to us. So the magnitude of the work we do, it ranges from 22,000 to 284,000 per month. So you could see how much work are we giving out to our patients. So it needs a very thorough, well-calculated, monitored, and manageable logistical setting. The way we do ordering in our setting, we deal with suppliers. Suppliers which we are dealing with, where they send work or where we buy things or consumable from them, they have to be accredited in our setting. We deal with suppliers whom we know, not anyone who will just come from the street and say we sell this. That is number one. We deal with people whom we know, and they are on our database. You will see when we go down. And the way things has to be procured and approved, the lab has to capture the order for the item they are looking for. The manager has to look or see to it that it is approved, after which the person, because our setting has got also run in the way of a business manager, as I said, it's a little bit different from other settings. So the business manager, because it's the one who has to see whether it is making business or not, they have to also approve. And then the final approval is by the financial manager, who will say what has been ordered as per the budget which we have for that items, will also approve. And then the order being forwarded to the supplier, and the supplier make a delivery. It seems quite complicated. However, the logistical part has got its pros and cons. That is what we wanted to highlight for those who want to follow the same route, to say, look at it holistically, because at times you find yourself in a setting whereby your supply cycle, it becomes a challenge. So meaning that one thing which you have to have in place, think about it. You are doing this for your client. You are serving the customer. So the product which you have to select or the consumable you have to use, it has to be exactly what the doctors ordered, not another way around or compromise, because here we are dealing with people's life. So you have to know whom you are buying from and why you are buying that. So the product selection is quite critical. So when you are buying what you are looking for, it also leads to a point whereby you have to know your forecasting. How much do we have? Then meaning that even your inventory management it has to be in place and in order. Why do we do that? For making sure that we don't have shortage of stock, or we overstock, or there is no stock at all. Those are some of the things when you have this, you make sure that they are in place, because those are some of the challenges. When we look at our setting, we realize that maybe let's share with fellows to say this thing, it might be in paper good, but there are other challenges. So we look at the management system tool, which we have to apply. So as a lab, we realize that there are a couple of things which we can apply. However, the one which we applied to look or monitor whether our stock are working appropriately, it was quality indicator. So the quality indicator, according to the way it is supposed to be as well, it is a process approach. So you have to have data and you monitor that on monthly basis to see whether what you are doing, is it effective or not, or is there efficiency on what you have to acquire or buy or procure. So the quality indicator which we have been using, if you look at the data which I provided here, these are the quality indicators which we measure ourselves on regular basis. So from April 2020 up to March 2021, we look at how we were performing on certain areas. So there was one department which within our setting, which were, if you look at down on stock control, we realized in October 2020 and January 2021, there were gaps. So there were some times where we find that stock is out for more than enough days. So meaning that we have to look at what has happened. And if you look at it, some of this stock, they also affect the running of our equipment. I'm not surprised on the other side, the one which is above equipment downtime as well was affected. So we look at what could have been happening. So on investigation, because those are some of the things which we have to look at, that there were back orders. So for us to avoid that, what do we do? Because we are dealing with patient life here. I will give you another example of another lab as well, another department within our business unit or the academic setting, where as well with them, it was consistent. If you look at it as well, this was a challenge. And then it goes to a point where after some times, we realize that no, this we have to do it accordingly because it's giving us a challenge on regular basis. So one of the things which is quite critical is investigation and the cost analysis to be done accordingly. So that is what we did. And on that part, as a lab colleagues, we had to look at what this quality indicator entails. You have to investigate thoroughly. You identify where could have been the problem, and you get the data. You look at the underlying issue, and then you look at what needs to be done accordingly. So this is part of the strategic action to be taken whenever you realize that we are having a challenge. So what we looked at, it was the matter of saying, here we are, we need a lot to be done. So we did the root cause, the corrective action as such, which part of it, we realized that the departments on our procurements, they were not looking at what could be the helpful information to follow. So if you look at the system we have an electronic system for procurement. However, it gives us a leeway to say, look at how your suppliers operate. Do they have everything in place? Whenever you procure, do you even look at how the procurement system operated or what the outcome of your procurement entailed? Part of it was that you have to make sure that all documentations are in place. Those documentations include within the database to say the back orders. Did they send you anything on time? we try to look at those typical data to say, have the labs been looking at that? After which we realize that some of the things are beyond the labs, reach, because in some instances you find that the back orders, they are from procurement office, which has to be communicated on regular basis. But we realize that if we follow the reports for procurement in a better way, whereby we do the overdue report, we look at the open purchase orders as well as the receipt within the departments for per a month to say, this is what we have ordered. This we didn't do. On time, can we achieve what, or can we make sure that whoever who is doing that, we write a report and then we look at it to say, on monthly basis, this is what we have been looking for. These are not being done accordingly. Then what do we do? Because on this setting, we have a certain challenge, be it if it's a procurement officer, we have to note and then report to the relevant departments. These colleagues, I can assure you, it did work wonders on our setting. As much as we realize that because we are dealing with a system which is quite complex a little bit, there were some challenges which we thought we have to look at as well. So there are changes on consumables prices, which sometimes they have delays. However, when we order on time and accordingly to avoid these logistical challenges, we realize that as much as we have this challenge, we have to note them. All our loan, our line manager approval bureaucracy have to be conscientized of the challenge and the work at stake. So as a result, what has happened, these are some of the challenges which we had on our side, which the lab will say is beyond our reach. However, we made sure that whenever we have our items, all the items which we have to order, they have to be put accordingly and well in a way that what we have ordered, when we run short of whatever, the procurement division can know what exactly the lab needs. So automatically the system will show us what and when to be ordered. So the critical part here, colleagues, was that we have to order accordingly and to meet our needs. And as such, whenever we look at our space, because the aim there, as I indicated, is not to over order. So we realize at times you find some saying we have a store or space availability as a challenge. But this, we normally review them. Whenever we have our management review, we'll look at what are the available resources to avoid that, which as well, colleagues, in this particular area, quality-wise, you have to know challenges have to be addressed on which parameters. Those are some of the things which we look at. So the documentations which you have to have at a regular basis, we made sure that whatever which we ordered and what has been invoiced to us, are they accordingly? Because if we don't have that in place, that is a catastrophe. Colleagues, when we review whatever processes we have encountered before, so we have to plan from what we have encountered, and then we look at it holistically, of which that is what we look at so that we can execute the plan accordingly, and we review the plan on regular basis. This is what we try to encourage people who are having these complicated, complex procurement processes, so that whatever which they do, they know how to do it. So the inventory system, you have to know which one are you using. Is it working for you the way it is supposed to be done? If you don't have an inventory system as well, it will be a problem. The other part, beside the procurement processes, which I showed you how things we monitor within our quality indicator to say where we are, it was the supplier themselves. The suppliers whom we are dealing with, we have to evaluate, are they delivering on time? Are they doing things accordingly? Because if they are not, we are having a challenge. So those things which we have to look at, these are things which we evaluate, is another tool which we use to evaluate our supplier on regular basis. This is done monthly. And then after a period of time, we have a management review where we look at supplier A, is it delivering? Supplier B, when it comes to suitability of whatever which they are sending to us, the downtime, is it done accordingly? The overall customer service for this supplier, is it what we are looking for? And then if it's not satisfactory or is poor or they are not, they are so erratic, we note them. So we go back to our system host, which is the Procurement National Department, and then we notify them. We don't just do that willy-nilly. We have to have proof that this supplier didn't have proper procedure to deal with whatever which we have requested. So like in one of these, which we highlighted, Lab A requested and they realized that there were delays of some tubes for a particular period. And as a result, we sit with the supplier, we indicated their fault, we notify them as well, this is what we are going to do if you don't improve. So as such, on all the scenarios we have, this serves as well as part of whatever which we do, you have to be sure that action has to be taken because your purchasing and inventory management is affected. So what is supposed to be there, you have to make sure that, number one, there is clear interaction between you as a lab, of which in our case, we interact with our suppliers, and then the purchasing format. It has to be, or processes, they have to be in places. The way we receive our consumables, it has to be appropriately. The way we manage our inventory, it has to be accordingly as well. We look at what the better inventory has to be. Some of you, I know you might have this, but you have to make sure that your inventory system works accordingly. How does it come to be like, to have a perfect inventory system? You have to look at your lead time, the average usage of your consumables, where you store them is quite important. The shelf life and expiry date of your consumables. So those are the things which will determine when to reorder. Because that reordering, I'm telling you, it can make sure that, or help you to see what is required in your setting. Because if you just order without knowing whether they are still there or we are over ordering, we are going to face a very difficult challenge. If you look at the standard itself, it warrants us, whenever we have a new formulation or you want to buy a new reagent, they have to be verified. That is a requirement. So meaning that as well, this part, look at it holistically, that how much is it helping you as a lab? Are you getting your reagent being verified to say, we are not just doing for the sake of it, but the standard requires us to look at this formulation accordingly. What happened after sometimes up to this year, if you look at it, there was an improvement after we discussed with our departments, management, and then as much as during March, we realized here there was a change of pricing, which as well, the lab couldn't suffer that much or suffer at all because the stock control over a period of time, we realized that they are doing quite well. So there are things which we have to look at as a pillar of your procurement. Your supplier interaction is quite important. The purchasing process is quite important. The way you receive them is quite important. The way you accept and reject your samples is quite important, which make all your inventory management system to be in one place. So we have to look at that as the foundation, because if that is not there, I'm telling you, everything will be, we will be suicidal for all of us. So there are principles which we have to look as well, which I know that because of time, we have to look at the purchasing and inventory process map to say how things interchange if we do them accordingly. Because according to the ISO, if you look at ISO 15189, on section 4.6, For those who are on medical laboratories, they can see what needs to be done there. It shows how once you work with a defined supplier and your processes are also defined, for you to have or to know what you have to order, the product you use, how you use them, whether if it's first in, first out, it will be easier if you have a process in place. Purchasing and inventory, it has to be in place. We will ask Ian to share with you this documentation because, or this presentation, for some of us to look at what exactly we need to have in place so that we mustn't have the same challenge. Colleagues, I would like to thank my team. If there are any questions, I just wanted to stick to my time which I'm assigned. To thank the team here in Tshwane, and then the procurement team from the NHLS, my Dr. Matsao, as well as Azwi, and then the team from who attended at large. Thank you very much. Over to you, Ian.
Thank you very much, Chaka, for that insightful presentation. It's great that we can learn from each other and we can be able to share experience, real life experiences. And to note that at the end of the next presentation, we'll have time to address questions and also to have discussion emanating from the presentation. And the next presenter is Prof. Andy Bakalo. Prof. Andy Bakalo, as he's sharing his screen, he is the Director of Training and Capacity Building in Health Supply Chain and is a Health Supply Chain expert at Empower School of Health in Geneva. And he has vast experience in procurement and is one of the co-authors of the Yellow Book on Managing Access to Health Technology by MSH and WHO, and the e-handbook of health systems in action. He has over 30 years of experience in working in international funding institutions and bilateral donors in low-income countries to support the healthcare. And the main focus of previous experience includes effective management of medical commodities and especially implementation programs for introduction of new diagnostics for neglected tropical diseases. He has recently co-authored Guan Supply Chain for Emergency Responses, COVID-19 platform, pandemic preparedness training modules, including for laboratory diagnostics. He's going to present on the impact of point-of-care rapid diagnostic test, key testing on clinical laboratory procurement and logistics. Will there be more or less volumes of suppliers for the lab to handle and manage? Over to you, Prof. Bakalo.
Greetings and welcome to all. Okay. Let's just see if I can, okay, we don't need that. I've already been introduced. Okay, I'm going to talk quite quickly, but you'll find lots of references on the screen and you will get the slide deck afterwards. And there will be a chance for questions very shortly. So I guess the main question is, why is lab logistics, why is it always so difficult? Why is it always a problem? In every country, it's always a problem. And part of the issue is that nobody ever wants to be in charge. Procurement and supply chain say it's laboratory. Laboratory say it's PSM. There's no professional approach, there's no status, there's no importance given to the job. And often there's very little resource allocation. That's the management side of it, and we've heard how it can be put together well in the previous presentation when we have an overall good management approach. But there are also major technical issues. PSM, procurement and supply chain for health, is often really geared up for pharmacy, for essential medicines. Most countries have an essential medicine list of about 350 items. For laboratory, 3,000 items is not unusual. we're an order of magnitude greater. And that requires a fundamentally different approach. We've got bulk powders, we've got liquids, we've got individual kits, we've got tiny little components and spare parts, often completely mixed. And some of the commodities, like the controls and standards, have extremely short shelf lives. We have to turn them over within 30 days. So we have a lot of technical challenges in addition to the management challenges. And it's understanding the breadth of those challenges that makes it difficult and requires a fundamentally different approach than other health commodities. There is lots of guidance available for procurement and supply chain management of clinical laboratory items. Lots of published documents there on the screen in detail, 80, 90 pages long, many of them, and you can reference them on the URL guidance that is given there. Well, that's all very good, having these long manuals and documents, but how do we actually get it to work? How do we make it happen? And we start by recognizing that PSM for laboratory is fundamentally different to medicines and pharmaceuticals. We have to have a different approach. Second point is to recognize procurement and supply chain costs money, typically 5 to 10% of the commodity cost to actually manage the procurement and supply chain process. And often there's no budget there for that. Somehow it gets lost. We focus on the commodities and never on the management of the commodities. And we have to recognize that to handle this volume and range, we need an overall systematic approach. Individual ad hoc systems are not likely to succeed in the long term. There are 10 major factors, and they're listed in the manuals that I put on the screen on the previous slide. Well, that's good for now, but we also have to recognize the future and this massive change that is occurring to point of care diagnostics. There are some in the health community that will say, well, that will be the end of the central laboratories. We won't need them anymore because all the diagnostics will be done at the bedside or in the field. I believe that's utter nonsense. I believe point of care testing will vastly increase the workload on the central laboratories. And that's for two reasons. One is the point of care testing needs supervision and oversight. It needs quality assurance. How do we know it's being done correctly? Just having a kit doesn't mean we ensure that it's being used properly and that we're getting accurate results. If we look at the guidance from the Canadian government, who is at the forefront of organizing and managing such changes, they are saying the clinical laboratory is responsible for laboratory testing wherever the test is performed. So the central laboratory is going to have this major supervision, quality assurance function. They already do it on their own testing. Laboratories share samples with other laboratories and have a full quality control program. But somehow on point of care testing, we've forgotten to do that. How are we monitoring the use of the rapid HIV test kits? Do we take samples and compare that the system's been operated correctly and that we're getting accurate results from them? We need to bring that in, and that's a major area, both for laboratory and for PSM together. And I'm going to explain what I mean by that in the forthcoming slides. When we talk about point of care testing, let's understand there's a very wide range of activities. There's the type do at home, typically by home pregnancy tests. Type we do in the community, typically a community health worker with very basic training does a rapid test for malaria. Type we do at clinic and health posts, which might be a nurse, or might be a clinician, who does very basic kit testing. HIV, malaria, syphilis these days. There's a peripheral laboratory, a district laboratory, which might be doing some rapid point of care testing, or in the hospital itself at the bedside. Little more advanced, And then there's a hospital inpatient bedside point of care testing. So when we talk about point of care, it's not just HIV rapid test kits. There's a whole range of point of care testing that's coming to us. We have to think how we're going to manage that and how we're going to manage the procurement supply chain elements of it. And the critical role is quality systems. How are we controlling the quality of the test kits themselves? But more importantly, how are we controlling the test kits of their use? Are we actually getting accurate testing? Have the staff been trained? Are they operating correctly? In order for point of care to reach its full potential, it's got to have that quality assurance. If it doesn't have that quality assurance and referral testing and monitoring of its operation, it is much reduced in value. I'm not using the potential of it. I'm not gaining the benefits of it because I don't have this quality assurance factor that's built into it. Well, what are the actual diagnostics we're going to be using? Well, World Health Organization has published the essential diagnostics list. Just like we have the essential medicine list for pharmaceuticals, there is the essential diagnostic list, and there's also a presentation on the new point of care testing. A lot of that is dominated by HIV testing, and that's partly by expense, but there's still lots of other areas coming along to increase the range of point of care testing and to increase the need for quality assurance monitoring of its operation. But the WHO list gives us a good guidance, gives us a good backbone to work from on what we're likely to need for the future. The manufacturers are convinced the point of care testing diagnostic market is going to rocket, going to go absolutely massive. Well, yeah, but that's all North America. Look, there are billions of dollars in North America. It's not going to happen in Africa. We don't have the money. We don't have the resources. We don't have the financing. It's all very well, Prof, talking about this, but it's not really coming to us anytime soon, is it? Well, the manufacturers believe it is coming to Africa. They're talking about tripling sales of point of care diagnostics into Africa. They believe it's coming. Most of that will be occurring in the private sector, but there's still resource funding for public sector programs to occur. And that means a massive change is coming. It's coming to laboratory operation, and it's coming to procurement supply chain of diagnostic products. Manufacturers don't invest without a very good business model. They are convinced the African market is really going to boom on point of care diagnostics. Well, that's all very good, but how does it actually affect procurement supply chain? To give you a simple example, some of you will be aware already of the new lamb urine tests for TB. You'll see at the bottom right there, Zimbabwe already has them in the TB guidelines. So we're testing urine now for TB markers. It's a little test kit that comes together. It's called the lamb. Okay. It's available from the Global Drug Facility Catalogue. Many countries are slowly starting to adopt it. Well, it's very good. But if I compare what I have been doing in the past, which is sputum smear testing, first, let's just look at the volumes. Well, sputum smear testing, I pretty much need a box of microscope slides and some pipettes and cups and other things, but I need that for the lamb test as well. For the lamb test, I've got these packaged cassettes. I'm going from a small box now to a pallet load, a 3 cubic meter pallet load of diagnostics to perform the same test. Means more warehouse, more transport, more logistics. Instead of it going to the laboratory, it's now got to be delivered to all the community health workers, all the small clinics, much more distribution. That's a massive impact on the supply chain. But there's also the technical aspect here. What's the storage requirement on a box of microscope slides? Well, it's not very much, is it? It could be plus 40 degrees, minus 20, it wouldn't matter. The humidity is not important, providing it's reasonably clean, that's all I need. What's the storage requirement on the lamb test kits? Are they temperature sensitive? Are they humidity sensitive? Do they need careful handling? I don't know, it's all new. So I need a much greater technology approach to the point of care testing items. They're all high tech. If we look at the predicted impacts on laboratory procurement supply chain from this, we're seeing in organizational major reform, massive change to the goals of diagnostics and to its focus, moving away from bulk testing at a central laboratory. Most of the bulk testing will go to the field, but managing, supervising activity. In human resources, much more greater product knowledge. I don't need much product knowledge for a box of microscope slides. I do for a lamb test kit. Much greater PSM ability. In finance, if we can keep pace with the increase in funding required, and that's a big if, then we still need to pay for the procurement supply chain. I still need that 5% to go into the supply chain to make it happen. Infrastructure, more warehouse space, more distribution capacity, wider distribution going to community health workers, and much greater use of IT and communications. So in this, PSM has a critical role. One of the major barriers already identified to the slow uptake of point of care testing is the failure of the supply chain to be able to deliver the items. We're not getting them through. We're not getting them through because we haven't planned for the extra warehouse and the extra distribution and the extra technical knowledge that we need. And we have to change that. Point of care testing is coming whether we want it or not, and it's going to be thrust upon us, and it's better that we get ready and embrace that change. Recognize supply chain is reducing the effectiveness of point of care testing, and it's starting to get a bit of a discredit, a bit of a bad name, because we can't get reliable supplies. We're not getting through to where they're needed. Well, that's all very good, but what can we actually do about this? It needs much greater cooperation between the lab and supply chain. The two need to work together much more. Only the laboratory has got the technical knowledge on the point of care testing items. The PSM staff don't have it. The PSM staff have the PSM knowledge. So either we've got to train PSM staff in laboratory diagnostics, or we've got to train laboratory staff in PSM, and probably we need a bit of both. But the importance is to recognize the function of working together, the need for the technical input from the laboratory, the need for the PSM operation to embrace and understand the future volumes that are going to be involved. Both need much greater flexibility and response times. Our point of care diagnostic rollout is failing. It's failing because we're not getting the supplies through. We need to be much more flexible, much more agile in embracing the new technology, the new test kits, and in gearing up for them, recognizing the enormous potential and health benefits they can bring if we can work together, if we can understand the nature and the magnitude of the challenge that faces us. So my overall summary is massive changes are coming, and we can't stop them. They're coming whether we want them or not. They cannot be ignored. If we fail to embrace PSM as lab people, it won't work. If PSM fail to embrace diagnostics and lab technical inputs, it won't work. Both sides must learn to work together and become far more agile and flexible. Then we can capitalize on the enormous benefits that point of care testing can bring. But it needs massive reorganization and huge infrastructure development. My message is embrace procurement supply chain, embrace lab technical inputs now, and bring effective PSM to point of care testing. Okay, That's my presentation concluded.
Thank you very much, Prof. Andy Bucklow, for that insightful presentation. Point of care is here to stay. We need to find ways of managing it as lab professionals, and the logistics also comes into play. And we are open for comments and discussions emanating from the presentation made, and joining us also on the panelists to attend to comments, questions is Prof. Rajiv Erasmus, who is the president of the African Federation of Clinical Chemistry, and he serves on the International Federation of Clinical Chemistry Task Force on COVID-19, Public Relations, Point of Care Testing, and Committee for Biomarkers for Diabetes. And he co-founded the College of Pathologists of East, Central, and Southern Africa, COPESA, in 2010, and is its current vice president. He will be joining us as the panelist for the roundtable discussion. Any questions? You can raise up your hand or type in the comment box, and we'll be able to have some discussions emanating from the presentation. As we wait for questions, Prof. Erasmus, do you have any comments you would want to say emanating from the discussions?
Thank you so much, Ian, for that kind introduction. I think I just first of all want to congratulate the two presenters for two excellent presentations. I think what they have emphasized is that without a good management system for procurement and supplies, we don't really have good quality. And we all know that good quality of our testing is critical to good management of patients. And this area has been frequently neglected. No doubt about it. In fact, I do remember during my training as a chemical pathologist, nobody ever talked about supplies and how to manage them. And I think this has become such a critical issue since labs have become bigger, since we have a larger menu of lab tests. And I think the last issue, the last presentation, which was on point of care testing, which is one of my favorite areas that I frequently talk about, is that this issue of supplies is also critical for maintaining the quality of point of care testing. So I was actually pleasantly surprised when I saw this as being discussed by Professor Barry Clough. So, and that was a great presentation. And I think it's becoming such an important issue because, as he said, point of care is here with us in Africa. And we know that we already have very dedicated point of care programs for HIV viral loads. We also have that now for malaria, the rapid tests. We also have that for TB as well as for syphilis. So point of care actually is right here in Africa with us. But the challenge is, how do we manage the quality? How do we manage the supplies, which has been pointed out is critical if we want to have, if we want to improve and manage the quality of point of care testing and the results. Over to you, Ian.
Thank you very much, Prof. Erasmus, for the input and also for your leadership as we try to find ways of learning from one another in the African continent in terms of our lab systems. I do not see any questions or any hand. I see two hands raised. All right, we can have the first one. Can you kindly unmute your mic?
Hello. Can
yes.
you hear me?
Yes,
Okay.
Yusuf, kindly unmute your mic.
All right. Thank you for the opportunity to speak. Well, I'm a medical laboratory scientist in Nigeria, though I'm currently in South Africa for study. And quite interesting that I was able to join this session, which was a mind-blowing session from Mr. From Prof. and also Mr. Chaka. So I just have like two questions for both the two presenters. About sole suppliers, I think Mr. Chaka mentioned something about sole suppliers. So how are you able to maybe identify a sole supplier among a mix of various suppliers? Because this is something I've been battling with, I myself as a student though, but because the research lab I'm working with require all this. So at times I find it difficult maybe identifying a sole supplier. So just like I said, how are you able to identify the source suppliers among mix of various suppliers? Then to Prof, just like he said, and just like Mr. Erasmus also said, that POCT is here to stay. Well, and also about laboratory logistics, we all obviously know that it's one of the complicated systems we have when we compare it with other logistic systems. So looking at POCT when it comes to in terms of calibration or validation of even the device or some other things which actually have to pass through some rigorous, like in Nigeria now, it have to go through maybe like maybe NAFDAC or even the Medical Laboratory Science Council of Nigeria. So I think I see it more like it getting much complicated, though I don't want to see it as such. But how are we going to go about maybe managing all this and even making it effective? Thank you.
Thanks very much, Yusuf. I will ask Chaka to go first, then Prof. Backlog, and Prof. Erasmus if he has any comments. Chaka, can you unmute?
Yes, thanks, Dr. Machingura. Yeah, on sole supplier, we have a system. Number one, our setting for procurement is in this format. You have to adhere to our regulatory requirement as a supplier, number one, based on your registration with the requirement, be it of the country with regards to rendering certain service. We have SAPRA regulations, which is South African, is more of like FDA in America. So they will look at what are you providing as well, the service which you are rendering. Are those products aligned to what the regulatory, be it health and safety regulations, or are they user-friendly to what we are looking for? So we have our own process as a criteria which will say this is what we are looking for. Then there are some instances where you realize that from what you are looking for, there is no other supplier anywhere near. It's only maybe somewhere in Europe. There might be a deviation of some sort which has to be written. However, there has to be a guarantee of some sort between this, if you remember on that 8 principles of quality, we said there has to be a mutual supplier beneficial agreement of some sort. So we don't want, because they are in Europe, there's like they're doing favor to us because they will come and dump their own things here. So what we do, we have to have an agreement to say, what are you providing? Is it suiting what we are looking for? And then we take it from there. So for sole supplier, it's registration requirements, be it for the country or for what we are looking for here as a lab. And then on monthly basis, we evaluate you because we don't want favors. We want someone who is going to work with us. And that's it. I'm not so sure if it answered his question.
Thank you, Chaka. We'll allow Prof. Backlog to say, to go through, to add also.
Okay, I think let me take my side first, which is the calibration and regulation of point of care test kits. If we look at the case of rapid COVID test kits, there are over 600 different kinds. I would say around 450 of them at least are suspect. So it is a real issue. But WHO does pre-qualify and does give guidance. Let's face the reality. Many countries do not have the technical resources to undertake massive investigation and regulation of kits of this kind. Global guidance can be a good benchmark for us to follow. We don't necessarily have to undertake everything individually in every country. It's massively expensive, and we don't always have the technical knowledge and backup to do it. So WHO guidance is a key in following that. Somehow in the past years, people have moved away from the WHO pre-qualification program and guidance. I think we need to come back to that. One is about suppliers, and I think the other one about suppliers is countries need to have commercial reality. If you're a low population country, issuing an international tender is frankly nonsense. If you're Lesotho, Namibia, with populations of 2 million, you are never going to buy enough. You're buying the same level as one district hospital in Europe. You can't operate on the international market. The suppliers will eat you. You have to go through one of the larger protecting agencies, like the UN or other pooled procurement systems. We have to get real on this. For larger population countries like Nigeria, yes, you can operate on the international market, but you need to be savvy, you need to be very aware of international conditions and what's happening. And regrettably, procurement units rarely get the resources to do that. So I'd come back to operating with WHO pre-qualification guidance and through some of the UN procurement and other pool procurement bodies. We're often trying to do too much with too little resources. Okay, that's me. Thank you.
Thank you very much, Prof. Backlog. And Prof. Erasmus, would you want to add anything? All right. We will allow Dr. Sydney Chikukwa to pose this question or discuss input on discussion. Dr. Chikukwa, can you unmute your mic?
Hello, good morning. I have 3 questions. The first one is that one of the challenges in managing stock is the issue of expiry dates. How are the manufacturers held accountable from non-profiteering use from profiteering use of expiry dates, maybe shortening the lifespan of their products so that they can sell much? That is the first question. The second one is the issue of point of care. There is a resistance to it, especially from the lab side, because of the fear of losing the field to everyone else and making the laboratory scientists disappear as the work is now handed over to other departments of the hospital. How is the international platform taking care of the laboratory's fears and concerns about losing their profession? The third one that I would want to ask is the issue of point of care. There are a lot of manufacturers coming in the field, and how are they regulated? Because they are massive people, and how are they authenticated, and how can one also choose from this array of suppliers emanating from different countries to ensure that these products are conforming to whatever they say they do? Thank you so much.
Thank you very much, Dr. Chikukwa. I will allow Prof. Baklo to go first, and then Chaka and Prof. Erasmus if you have any input. Prof. Baklo.
Okay, from among many suppliers, again, there is the WHO pre-qualification and WHO guidance lists. There are also lists published by other donors, such as USAID, of products which they've tested and certified to be okay. So that is first off. There already is guidance available on most items. Concerns about point of care testing, frankly, the international community is not doing a lot. It's an area that needs to be addressed to help to allay fears. People are still grappling with the huge changes that point of care testing is going to bring. Really, the focus has been on the technical aspects of point of care and not upon the humanitarian and staffing aspects. And that needs to change. We need to look at that and how it's going to affect the organization and staffing levels. I think it will drive an increase in the need for laboratory staff, but that's my personal opinion. Okay, I'll hand over.
Thank you, Chaka.
Thanks, Dr. Machingura. Yes, when it comes to the first question of how suppliers could be held accountable for this short life or expiry reagents, it is twofold. What I will advise colleagues to look at, know what you are looking for in the first point. I will tell you what we normally do in our setting, because we know there are those who make profit out of that. You have to have a policy in place and procedures regarding how you wanted your processes to be followed, so to say, be it on procurement as well as what you wanted to meet with whatever you are buying. So this is how we deal with it. When we have a service level agreement with the supplier, there is a technical group who will, or people who will look for the equipment which we are looking for, which we know that this, it has to meet what we are anticipating to have in our disposal or within our lab. From what is the requirement for that machine or analyzer to operate, there will be reagents. So of which most supplier will try to catch up as well. Sometimes they entice you as if like they're giving you the analyzer for free, whereas the big catch is on analyzer. So what do we do, because we know what we are looking for, part of the legal part, which we conscientize the supplier with, is to say we have to agree. Because we are buying in bulk, this has to be an agreement of saying, once your consumables, which you supply us, or you are the sole supplier of them, which you are saying we have to buy in bulk, and they expire before we even do whatever which we are supposed to be doing, you have to take them, or you discount them, and then you replace them. That is what we do, and it becomes in black and white. Because the issue here is not for them to say, here you have what you said you wanted, but that mutual agreement between us and them is quite critical. So that is how we deal with those, where we put them accountable. And it becomes an issue which is clear, as simple as that.
Thank you very much for and we go to the next question. How can the lab maintain and keep with change, considering these new developments? Remember the issues of equipment harmonization, and as well as WHO 2000 principles and guidelines. I'll ask Chaka to go first, then Prof. Baklo to go second. how can the labs maintain and keep with change considering these new developments, and remember the issues of equipment harmonization and as well as the WHO principles and guidelines.
Ian, if I might
Yes.
just come in, if you don't mind, on that question, because
Yes.
I think there was another question that was raised by by one of the earlier participants regarding the threat posed by point-of-care testing to our colleagues in the lab. So let me just comment on those two, if you just permit me to do so.
Yes, please. You are part of the panelists.
Yes. So I will just address this thing about the perception by the lab personnel about the threat. I think Prof. Andy had already mentioned that, look, it's not really a threat. In fact, it's going to increase the workload. The reason being is that according to the regulatory framework, the lab will be accountable and responsible for monitoring point-of-care testing with respect to the quality, with respect to the management structures. That's the first thing. The second point is that point-of-care testing is regulated by ISO 22870 standards. And these standards have stated in very clear terms that there will be a management committee, a coordinating committee that will be overseen by the lab. So in effect, on a practical level, both the lab and the operators, the point of care operators and the management of these operators will very much be done together as a team. So I think there's really no threat. I think the problem or challenge is, how does the lab get involved? They must not stay and watch, but they must be an active participant. And that actually depends very much on the hospital coordinating committee, the point of care testing committee. That's the first one. So I think there should be no fear about the two. The second thing is that the Africa Federation of Clinical Chemistry has actually put up a committee on point of care testing to harmonize and standardize point of care testing across Africa. And the first thing we are doing is to look at the policies. In other words, we want to harmonize all the policies on the African continent so that we speak and practice point of care testing as one large organization that is ensuring that the quality of point of care testing will be effectively managed and will also be the same as that in the lab. Over to you.
Thank you very much, Prof. Erasmus. It takes me back to many years ago when I was a young boy. Our first major debate on point of care. And really, I've now come to the realization to say, point of care does actually review that the lab should take leadership on diagnostics. And hence, even as Prof. Baklo was indicating, the management of the supply chain, in point of care, it cannot be done without the lab. The training of the point of care testing, how we are going to do it. So it has to be integrated as part of the lab system. And coming to the other question that was raised, how do we keep up with all these changes? There is no substitute for continual development. The lab, the systems, things are always changing and updating. New methods are coming into play. and hence the need of us as lab practitioners to continually develop ourselves in terms of training, in terms of workshops and webinars like this. They allow us to keep abreast with the changes. And even workshops are it just reminds me that things like PCR during our time when we were youngsters, it was something that would be talked of and only a few people would be able to do, but we have had to learn it embrace it when it became more widely available. And hence it has to be on the job training, more and more training as we go. I can see a hand, Dr. Chale Matsau. You can unmute yourself to also contribute. You can unmute yourself, Dr. Matsau.
Thank you. Thanks so much. Yeah, thanks, Ian. I just want to first congratulate the two speakers. They really did a sterling job. It's almost as if I'm hearing them for the first time each time I hear Prof and Chaka speak, because I've really been fortunate to listen to them previously. I just want to comment, literally coming from Sydney's question, because we've had an experience recently where we were, I can say, bombarded with information regarding the need for the point of care in our hospital. And the reason is because in our setting, and here I'm referring to South Africa, the point of care is literally in the hands of clinicians, pharmaceuticals. If you go to a drugstore, you purchase a point of care, you use it. There's no regulation basically on how you can use it, how you can acquire it. Now, if I'm going to talk about patients that we are directly involved with, it actually leaves a really chilling feeling, because you wouldn't want to have a patient, like in this particular example that I started with, is the creatinine and urea request, basically, because they needed to take their patients, for example, to CTB. For those who are not on the clinical side, when you are taking a patient for a scan, you may need to give them an agent, we call it a contrast agent, that is going to make the lesion or the injury you are trying to investigate to be more visible. Now, unfortunately, the contrast, this drug or agent that are giving to the patients, can actually make the kidney function worse if the kidney function was already compromised. Now, in this setting, if the test is actually requested by the clinicians, it's going to be used by the clinicians. It can be nurses, it can be intern students, but we know that laboratory testing is understood by people who are in the laboratory profession. So I completely support the use of point of care, because it speeds things up, and in many cases, it can actually give you the answers quickly. But I just want to also support what Prof said earlier, Prof Erasmus, that until it is properly regulated, we are actually going to fall short in terms of really utilizing it properly. It's got a whole lot of value. It is not cheap, but it's going to give us the answers we need. But Sydney, I don't think the lab professionals are threatened by point of care, but the lab professionals may find themselves having to answer questions of things that they were not even involved with in the first place if the patient hasn't been properly managed. But if we can work as a team, as lab professionals and the hospital, in case of an academic hospital like ours, or any setting where the point of care is used, you need, for any point of care that is being utilized, you need to have in that setting a point of care committee that is going to oversee it. You need to have EQA for a point of care. You need to have regular IQC being done, basically, for any equipment that's being used. Now, we know in most hospitals in South Africa, at the casualty emergency unit, basically, you have the blood gas that's being done. We don't even know how this is done because we're not involved, at least in most cities in South Africa. We need to have the laboratory professionals being involved in every point of care, including the glucose monitoring. The laboratory need to be involved for us to know that this is actually being utilized properly. Basically, this was just my comment, really supporting the use of point of care, but insisting on proper utilization thereof. Thanks, Ian, for allowing me to speak.
Thank you very much, Dr. Matsao. Colleagues, I will kindly I'll ask for your patience. We have three more comments, which I feel it's only fair for us to go through them before we close this webinar. Please accept my apologies for going a bit over time, but I just feel it's fair that we allow those comments to go through. The first one is just a comment. Being in private practice in South Africa, we saw an increase in price of freight flights, but also a decline in flight availability due to airlines closing down due to decline in revenue during the COVID-19 pandemic. This resulted in a 40% decline in domestic flight availability in South Africa. Also, depending on the lab items are being imported, we sometimes see that it can get stuck at the customs department, delaying delivery of some critical reagents and controls. Yeah, the freight is also an important aspect in our logistics as well. Some things have to travel between countries, across countries, and it's an important consideration in the lab. Thank you, Prof. Mike, for the comment. Interesting response from Prof. Erasmus. Indeed, the workload will increase on the part of the med lab personnel as they will be involved with validation, calibration, or regulation of point of care testing. But another comment, but when we talk about monitoring supervision is solely a government issue, and this is mainly government departments, but what happens to private labs? What will be their roles? Yeah, this is also a challenge for the private labs, but the private players will still be needed, because even with point of care testing, there is still need of lab testing. Point of care testing will not be for all testing. In this case, what will be the role of the private labs in point of care testing? Okay, that was the last comment. I will allow the panelists to make their parting shots before we close this webinar. We'll start with Chaka, then we go to Prof. Andy Bucklow, then Prof. Rajiv Erasmus, then we have then we close. Chaka, do you have any parting shots, any closing remarks?
Thanks very much, Dr. Machingura. I would like to thank my fellow panelists and also the audience. I really appreciated the time, and also to encourage fellow attendees as well to say, whatever which you have to do in your medical setting, know what you wanted to achieve and what you are doing, because that is quite critical in our setting. Medical lab need processes which are well mastered by us who are in leadership as such. Thank you very much, and all of the best to all those who are here in their endeavors. Thank you.
Thank you very much, Chaka. Prof. Bucklow, any closing remarks? Okay,
I'll just say a few words about freight. International air freight costs, according to the latest UNICEF report, are still about 15–20% higher than they were pre-COVID, and capacity is down about 30%. So it's still an issue. Sea freight prices are stable. There's no massive increase, but there is a shortage of volume. It's becoming increasingly difficult, and there are longer delays at ports because of congestion. So freight on all lab items is a major issue, and is likely to continue to be so for at least the next 18 months. Okay, finally, my thanks to everyone sitting through a presentation with so much information, and well done. Thanks to all.
Thank you very much, Prof. Bakalo. Prof. Rajiv Erasmus, any closing words?
Yes, in fact, I have quite a few closing words. The first thing is just to thank the two speakers. I think they were excellent talks, and they have really made us realize the importance of supply chains and how they have a critical impact on the quality of the tests. Without a proper supply chain and its management, the quality of the kits that are used can be compromised. That's the first one. The second one is that I just want to thank the Empower School of Health. They are really helping us in Africa. I think they need to be congratulated, and we need to see how we can use them further in promoting the quality of our education and training, especially with respect to lab testing on the African continent. And the third one, I just want to let you know, is that we have started, or we have implemented, or we have actually put up the first training course on point of care testing in Africa. And this is being done between myself and the Cape Peninsula University of Technology in Cape Town. It's a 9-module course which is spread over 1 week, and it also has a practical component which involves the various vendors. And so this is the first of its kind in Africa. Over to you, Ian.
Thank you very much to Prof. Erasmus, and I would also want to echo your words of thanking the presenters, Prof. Andy Bakalo, Chaka Ndou, and Prof. Erasmus, who was also part of the panelists, and also Giza Chow, and for taking their time in the preparation for this webinar, and the technical support that we are getting from Empower School of Health, and it's helping us learn from one another in Africa to help strengthen our labs. And also just to note that also our colleagues at Empower School of Health do offer short courses in supply chain management, and also have an MSc in supply chain management. You can always visit their website. It has been shared, and also they have a Facebook and YouTube page. And to note that these presentations will be also stored on YouTube, so you can always be able to access them through our colleagues at Empower School of Health. They also host this so that even if we would want to play back and hear again what you would have heard, and you have not heard it properly, you have a chance of playing it again and learning from it. And please look out for another webinar. We still have some webinars from the African Consortium of Laboratory System Strengthening. This year, we will be sharing the flyer. The next one is on lab management best practices. We aim to have it in October. So please be on the lookout for the flyer for that webinar. And we would want to thank all the team behind the scenes, Sonia and the team who were making sure that the registration and the webinar goes well. We just want to say thank you to them, and we also want to say thank you to all of you, the participants, for being active participants, and also for allowing us to go beyond time to, in order to address all the issues that have been raised. Thank you very much. Let's have a good day. Till we meet again, let's share the message that we have had. Let's have a good day. Thank you.